Good afternoon, everybody. Here with Josh and Paul and Deirdre. I got to tell you, I'm looking forward to this Sunday, Super Bowl Sunday. Just seems like a little bit of normalcy, which we're all looking forward to. And maybe the numbers today are indicative of coming back to a new normal. Very quickly, I can just show you the positivity rate of 3.14%. That's pretty good. Pretty good in the sense that it's the lowest positivity rate we've had since Halloween. I think 3.14 seemed a little scary on Halloween, but now it's part of a trend line in the right direction. The right direction meaning our infections are going down and our vaccinations are going up. Hospitalizations down, good capacity at our hospitals. Fatalities trending down, still desperately too much. The vaccine update. Connecticut's number 4 nationally. Josh is upset that we slipped the number because we had to lay off for about a day and a half given the snowstorms, but we will be catching up again by the Sunday, the end of this week. We have about half of our cohort of 75 and above who have been vaccinated to date with their first vaccination. That's extraordinary. A total of 460,000 in total. Other thing you may want to see here is our allocations continue to trend up. The state allocation is up about 5% week over week. That's about 64,000 vaccinations a week, plus 12% for the direct-to-pharmacy program. That's about another 11,000. Those are the CVS, the Walgreens, and the such. We can talk about that in a minute. The next chart. Just give you a little idea of the dosages and the variability there. This goes back to middle of December when we were just starting out getting people vaccinated. The yellow are the traditional health systems getting out to the general population through local health departments, pharmacies. And the blue is what we were doing in terms of the long-term care, the nursing homes in particular. So as you can see, over the course of the last month, the blue is disappeared as everybody has gotten their first dose and almost everybody has gotten their second dose at the nursing homes and increasingly at the hospitals as well. And now you see the yellow, which is broadly speaking what's going out to the general population. You can see scheduling is not easy because the numbers have been bouncing around a little bit. That spike you see on January 18th was a going away present from the Trump administration, giving us the extra 50,000 doses. With President Biden, you can see the numbers are trending up on a pretty consistent basis, which is, really good news. The federal pharmacy, you'll see, is an increasing ramp up there as well. I got to tell you, Governor Bill Lee and myself, as we help lead the governor's task force, we had a good conversation with Pfizer again the other day. Pfizer is part of our homegrown talent. We like to consider them. And, they gave us some good news. They told us that, look, originally the federal government made reservations for 100 million doses. Now they doubled that down for 200 million doses. And they're negotiating another round for 300 million Pfizer doses. And so they'll be arriving by the end of next month, and then the next tranche by early summer, and the last tranche by the end of summer. If you double that down with what we see with Moderna, that would be potentially 600 million doses. Obviously, you need 2 doses, but you can see we can virtually get everybody vaccinated if that trend line, stays true, if the supply chain stays true. And Pfizer felt very confident that they'd be able to get that delivered. And along the way, as you know, Johnson & Johnson, J&J, they're going to get their emergency authorization. We'd like to think within a week or two, and that could be yet another accelerant in terms of what we've got to do going forward. The other thing Pfizer said, which I think was interesting, it's mRNA, which sort of tricks your system, as we described before, in terms of creating the antibodies. So you can have a computer file sent to Pfizer that gives you an idea of what the nature of the variants are, say, in the Northeast or in Connecticut. And very soon, off of that computer file, they'll be able to computer design a very customized vaccine for, say, the South African variant or whatever the type of a variant maybe gets prevalence here in this region. So you get an idea of how the vaccinations are keeping up in terms of volume, or hopefully getting ahead of the variants in terms of volume, and how they're able to specialize the hardware going forward, going back. This chart is interesting. This is the online chart. You can get that. You can cursor over it. You can see where your town is. I think I told you that we're over 50% of people over the age of 75 have gotten vaccinated. You know, maybe a little bit easier in some of the small towns where everybody can go online, you can drive through. A little tougher in some of the cities, no question about it. But you can see that places like Stamford and Norwalk have done very well, close to our, statewide average in terms of 75 and over who have gotten vaccinated. We've tried to address this, though. We worked very closely with CVS. Originally, they were locating the CVS pharmacies to do the vaccinations, often in the suburbs. We've also now got Bridgeport, New Britain, and Waterbury. So we're making a big effort to make sure that we bring the vaccines to you. I had a good morning in Waterbury with my friend Neil O'Leary the other day. They are catching up fast. Their local Department of Public Health are reaching out, bringing people to the magnet school there. Obviously, they've got the online. They've also got a 211 and 311 telephone number you can call to get help. And contrary to my whole mentality about not inline, online, people can come in and file in person, and they have coaches there to help you do that. That's how Waterbury is going to be catching up in the 75 and overs. I can tell you in some of the, most of the local health departments are doing a very good job. Some need a little bit of extra help. Deirdre can tell you that in some of these cities, we're going directly to the healthcare providers, getting them the support they need, so that it makes it a little easier to get people vaccinated, and that will allow us to move to the next category very soon. So we're finishing up the 75 and above group. They should be essentially done 85% or so. I'd like to think by the middle of February, I'd like to think we'll have some good news in terms of scheduling for the next category, 65 and above, probably in the next week, 10 days. So that's coming up pretty soon. Anyway, if you're 75 and over, you're still waiting, there's the hotline to call, 877-918-2224. You can do VAMS, get your grandson to help you figure out how to get on VAMS and do it online. We're going to be rolling out additional retail facilities like Walmart and Walgreens, CVS, making it easier for you. Go to 211. We'll direct you to how to sign up to get your appointment at CVS when that time is right. Plug in your zip code. You'll be figuring out how to get that done. Hey, with that, let me just take your questions and send the tough ones to Josh and Paul and Deirdre. Thanks.
News 8.
Good afternoon, everyone. Governor, you talked about just a moment ago the supply chain and a lot of different possibilities. With all the places that people can go in the state to get vaccinated, with the news you received from Pfizer, does it seem like it'll quickly catch up? In other words, if you have a lot of places but few vaccines, it doesn't do you any good. If you have all these places people can be vaccinated and all of a sudden the vaccines are available, then it changes everything completely, right?
That's absolutely right. We've got the capacity to vaccinate 10 times as many people as we've got now. Down in Waterbury, they're getting whatever it is, maybe 100 a day, and they could do 10 times the amount. They are ready to go. But the good news is, 65, that cohort, pretty soon we want to get more into essential workers, more in the broader category. We're going to be able to open up that aperture, and I'd like to think we're going to see a bigger supply of vaccines. And we'll have more certainty on that in the next 2 to 3 weeks. That was the confidence we got.
There was some speculation that there might be an announcement as soon as today about 65 and above, and it being maybe within the next couple of days to schedule. So was that just wrong to speculate, or is it still on target in your mind when that age group can start to make their reservations?
Yeah, we had always thought 65 and above was going to be towards the end of this month, the end of February. I think we're getting that a little bit faster, but we're not going to be able to tell you that with certainty for another week or so.
And for Commissioner Gifford, there are some reports about people who have received their first dose, even second dose, and then still getting COVID. Does that speak more to maybe the time frame that maybe it takes a couple of weeks after your second dose, say, for it to really kick in, or is there some concern about that?
Well, as you know, the randomized clinical trials for these vaccines demonstrated that their efficacy in reducing severe illness and death was very, very high. So we know that both the vaccines that are on the market are extremely effective, but you do need to continue to wear a mask and follow the other social distancing and hand washing strategies until a couple of weeks after your second dose. So you're not fully immunized until you've had both doses. And it's been a couple of weeks for your body to develop that full immune response. So it's hard to say, about a particular case. Maybe somebody was exposed before they got their second dose and then became ill after. But the main point is the vaccines are very effective at preventing illness. And you need to follow those masking and distancing guidelines until you're fully immunized.
Thank you.
NBC Connecticut.
Hi, Governor. This is Michael Fuller from NBC. I just had a quick question, or two actually, back to back. Number one, just what is the filtering process for private pharmacies taking appointments for folks who are in state, also even folks who are out of state? I asked you that question because we know that there were people at CVS today who were recently turned away. So can you talk a little bit more about that filtering process for those private pharmacies?
Well, I'll start, and then I'm going to pass it over to Josh. But look, you got to live here in Connecticut or work here in Connecticut. You got to identify yourself as such when you sign on to, say, that CVS site to make that appointment for your vaccination. You're going to have to show proof that where you're from, and you're going to have to show proof that you're over the age of 75. Anything else on that, Josh?
No, that's the key. We have a reciprocal agreement with all of our neighboring states, as the governor said, that will vaccinate people who either live or work, but we're not entertaining people who are coming across the border who don't live or work here for vaccines. And I understand that some folks were caught at that facility, and I'm glad that's been addressed.
Well, I just wanted to follow up on that because these folks say that they received numerous confirmation calls and also emails as well saying they're coming from Long Island, saying that this was the place for them to be able to go. They arrived here once, and she even brought her 86-year-old mother to get the vaccine and hopeful that they would get it because they got that confirmation, and then were turned away. So is there anything that we could just clarify or would want to say to them, because they are saying that they got that confirmation even though they lived in Long Island?
Well, we can look into whether there was, not enough notification in the scheduling system somewhere along the way. But I think we've been very clear. We've talked about it multiple times. I've seen it published all over the press that you need to either live or work in a state to receive vaccination in that state.
Gotcha. Also, too, just following up on what we've heard from last night, late Wednesday evening, the CDC director says schools can safely reopen without vaccinating teachers. Just wanted to know, Governor, what your thoughts are on that for our state.
We're going to vaccinate teachers as quickly as we can. Right now, we're prioritizing teachers, and nurses have already gotten vaccinated, school nurses. Prioritizing teachers as well for testing to make sure they know that they can get back into that classroom safely.
And also as well, it's speaking of education, Miguel Cardona, it looks like he will be confirmed as the U.S. Education Secretary. Has the state started the search for a replacement? What does that timeline look like? Do you know?
I can tell you we've got a great deputy who's, filling in at this point. Paul can tell you about the timing of any potential search. But, hey, look, let's make sure that Miguel becomes our Secretary of Education. Let's do it unanimously. I think that would send a big message.
Yes. And one more, I'm sorry, this is my last question. I'm sorry, Governor, but couples, we've heard from viewers who are couples, they're unsure, I guess, just what the rules are for May weddings, which are now about 3 months out. And so wondering what that would look like. Some have heard from Governor Cuomo that he announced maybe weddings indoors will have a cap to maybe 150 in March. So just interested in if there are any rules that you have for weddings, event venues like that going forward, especially in that time.
Yeah, look, I know the scene. We're going to give you as much notice as we possibly can. I think we're going to hold off just for another couple of weeks, hold off to see what goes on with the variants, make sure these trend lines we're seeing right now are good. There's nothing worse than giving you a false start saying your son or daughter can get married and then we have to change course sometime in April. So I think we're going to have a much clearer indication in the next couple of weeks, and I'll try and give you clear guidance at that point.
Thank you, sir.
Fox 61.
Hi, Governor. My first question, Josh, this might be for you. Do the number of daily deaths count towards the daily decrease in hospitalizations? Somebody dies, a hospital bed opens up. If so, does that paint a different picture of the recent drop in hospitalizations that we've seen, considering that most people who die of the COVID-19 virus die inside of a hospital?
So to answer your question, yes. Individuals who die when they're in the hospital obviously contribute to the reduction in the census. However, they're a very small percentage of the total number of people being discharged and a very small percentage of the decrease in the hospitalization. So just for reference, less than 10% of the people who are admitted into our hospitals with COVID-19 ultimately pass away from COVID-19. So in other words, over 90% of the people who are admitted leave healthy and go home. So we've published the data before, and we can share that with you again, just kind of showing the overall trends. But overall, the decline in hospitalizations is largely a function of many fewer people being admitted into the hospitals in the first place, as we start to see declines in community transmission around the state.
Thank you. And then the CDC has about 10,000 more vaccines administered than the state's number reported earlier on. Do we know why the numbers are different? We've kind of seen that for a couple of weeks now.
We don't. We are asking the CDC, and we're trying to look into what that discrepancy is. So we don't have a clear answer on that yet. They do have a higher number than we do. We're pretty confident in our number, though. It could be a function of when the data is pulled on a given day. But we're continuing to look into that.
Thank you.
Channel 3 Eyewitness News.
Yes, this question also might be for Josh as well. You know, the 3-week forecast from the White House could be the solution to the overbookings that we saw this week. But do we know when those forecasts will start? And should we expect to see more of these postponements until then?
Yes. So on the White House call the governor was on a couple of days ago, they did share with us that the forecast we have for next week, we can count on for the future weeks as well, as a minimum. So maybe it'll increase further, but they said you can at least count on that number. So that's very helpful in terms of us being able to provide, better headlights for our providers about what they can expect, which we are doing. But I don't think, as we've discussed before, I think, the communication with our providers overall has been excellent. When they reach out to us, if they do have any challenges, we're usually able to help them. We've had a couple cases, as has been documented, where that communication was not as good as it should have been. But we do think those cases will be few and far between going forward.
The goal was to get everyone who was bumped by the storm vaccinated by Sunday, and that was around 10 to 15,000 people, correct? And we are good to go with them?
Yes, we're on track to have storm-canceled appointments caught up by the end of the weekend.
Sounds good. Thank you very much.
Connecticut Public Media.
Hi, Governor. It's Jeff Cohen. You mentioned the Super Bowl earlier. I'm wondering if you got any requests to extend restaurant hours specifically related to events like the Super Bowl and Valentine's. These are events that naturally bring a lot of people out. And I'm curious if that was part of the discussion at all. And secondly, do either of those things or extended hours cause you any greater concern from a public health perspective?
Well, as you know, Jeff, we extended the hours from 10 to 11 o'clock for restaurants. Did that in time for Super Bowl Sunday. But look, saw what happened after Thanksgiving, saw what happens in and around Christmas and New Year's. I want to make sure that Super Bowl Sunday, it's a great event. I'm really looking forward to it. I'm cheering for the old guy, obviously. But that said, we got to make sure it's also an event that we handle cautiously and make sure it doesn't create a spike up. The trend lines are so positive right now.
Just, was that a specific point of discussion, though, Super Bowl Sunday? Did that ever come up in a specific way with the restaurants?
Not necessarily with the restaurants, but look, we wanted to give them guidance early on. We knew this is a pretty big weekend, so it'd be helpful. But no, I wasn't going to lift that cap totally. I don't need this to be a big, big party weekend.
Thank you.
News 12 Connecticut.
Everyone, Dr. Gifford, this first question's for you. Bridgeport is falling really far behind the rest of the state in the vaccination rates. State Senator Marilyn Moore put out a letter a few days ago questioning whether the city's health department team is up to the challenge of administering the vaccine. And she asked you guys to actually send somebody to the city to help run that. Any plans to do that?
So we have been in regular contact with the team down in the city of Bridgeport, and we've got a very good and collaborative working relationship with them. And we've been working with them on finding resources to get their population vaccinated quickly, making sure that they have vaccinating partners. There are 2 federally qualified health centers in the area that are raring to go. Yale New Haven Hospital is helping us with some vaccination work down there. We've got some clinics that are being set up in collaboration with the city in senior high rises, in senior centers. There's going to be a clinic at a high school, I understand, and increasing access through the FQHCs. So I certainly appreciate the senator's concern. We are working closely with the city. We want to see those rates get right back up, and we're doing everything that we can to coordinate and collaborate with them to improve the access to vaccination in Bridgeport.
So it sounds like there are no plans to take over that effort from the city, though.
We're providing technical assistance, and anything that they've asked for, we've tried to provide.
Thanks, Deidre. Governor Lamont, to help the restaurants out, you've been letting them deliver alcohol with meals. There's a bill in the legislature that would codify that in law and extend it out for 3 additional years. You think that's a good idea?
I think so.
All right, easy enough. and one more follow-up question from the same hearing. There's another bill that would allow grocery stores to sell wine. Very controversial with the package stores. What's your take on that?
I jumped out ahead of that some time ago. I was with one of our local wineries, made in Connecticut. I loved it. They said you could expand our market and give us a better chance to stand on our own 2 feet if we were able to sell in grocery stores. And I said, I think that's something we should be looking at. And I still believe that.
I mean, the package stores say it'll put them out of business if you let somebody else sell the only thing that they specialize in.
I think a little competition is often good for everybody, but let's take a look at it first.
WTIC 1080 News.
Hi, Dr. Gifford. A question the governor was asked a few minutes ago. Wanted to ask your opinion. Teachers' unions are very insistent on vaccinations. Despite the CDC recommendation, is there any possibility of moving them up in the pecking order?
Well, as the governor clarified, they are in with frontline essential workers in our 1B prioritization category. And so they will be part of the rollout that we're going to be continuing to do of this phase. We have seen that schools and daycare have been able to function safely throughout the pandemic, thanks to really hard work of school staff, school administrators, and students and families who've been really conscientious about following masking and distancing guidelines. We're obviously very grateful to the teachers and the childcare workers that have been on the job throughout. And, we're continuing to work with our SDE and our school district partners to assist whenever there are questions about, contact tracing or mitigation strategies. And as soon as we can get the vaccine that we need to complete Group 1B, our frontline essential workers will be part of that rollout.
And this week, Manchester and Rockville hospitals suspended vaccinations starting today, I think. Any changes on that? It's probably for Josh, I guess, as far as getting them the supply they need to restart vaccinations there?
Yes, I mean, Commissioner Gifford and her team, and we're in regular dialogue with all providers. Where that dialogue is going well and the lines of communication are open, we can usually avoid issues like that. It's unfortunate that one occurred, but we'll work with them to get them back on track as quickly as possible.
Do you think that now supply is creeping up, that those kind of situations can be avoided?
Yes.
Succinct. Thank you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, we're hearing that innocent people around the country who had their IDs used by criminals to access unemployment benefits during the pandemic, they're now getting notices from state unemployment offices that they owe taxes on thousands of dollars they never even applied for. Is this something that's happening in Connecticut?
I got to ask Kurt about that. I do know about all the fraud going on around the rest of the country. A big hit in California, something in Rhode Island as well. Less so in Connecticut to date, but let me follow up on that. Obviously, that's fundamentally unfair. There are a lot of fraudsters taking advantage of COVID, including as part of the unemployment, pretending to be testing and vaccination centers. Remember, it's free of charge. Don't give them your Social Security number. Don't give them your credit card.
Okay, thanks for that. And also today, a Hartford healthcare doctor told a colleague of mine that they have the ability to create a database of patients with pre-existing conditions so they can be notified about when they can make an appointment for a vaccine. And he said that they're waiting on a plan from your administration. I wondered, where do things stand with that plan?
Well, I'll start, and then Deirdre can rescue me. But I know we're working with the CDC, trying to see what are those pre-existing conditions. What are those comorbidities? I mean, they had lists that included smoking and a whole variety of things. We want to narrow that list and make sure it really deals with people who are most at risk. I can tell you that people 65 and over, you want to know why that's our next category. A majority of them probably have some sort of a comorbidity already. Deirdre, what else?
Yeah, correct, Governor. We're continuing to work on that plan. We understand, I want to be clear, we understand people are very anxious for further information about who will be eligible that has an underlying chronic condition and when that they will be eligible to get their vaccine. So we're working on that. It's obviously complicated. We've heard from lots and lots of constituents with a variety of chronic conditions who are asking us to prioritize them. So we need to, as the governor alluded to, rely on the CDC data and the lists that they've published. We'll be working with our clinical partners like Hartford Healthcare to make sure that when we roll out this plan, it's smooth, it's clear, and it's as simple as possible for people to follow.
So the state will then be providing that list, right? I know that's what the subcommittee's been looking at. And then it will be up to these healthcare providers, these big groups like Hartford Healthcare, to then create their own databases?
Well, they're going to be a key part of that strategy. You're right, because they have the medical records that will help us identify people with the relevant underlying conditions. Obviously, there are going to be some people that have those conditions that aren't affiliated with one of those providers. So we'll be providing a way that they can raise their hand and be part of that rollout as well.
Okay, great. And Governor, just a quick question. You announced some money today for the hospitals. How much money does Connecticut still have in the Federal CARES Act? And if so, are there any plans for it, or has it all been used up?
The original CARES Act funding has all been allocated. There was a second round of HEROES or CARES Act funding. It was allocated, I think, in December. That has not been used up at this point. I wasn't aware, though, Sue, that it included money for hospitals. I will have to check on that. It was a lot of money, as you know, for rent relief, a lot of money for education, and ways that we can start planning. And we're getting some guidance now for education. That money can go out over 2 years. So it really gives our schools a chance to plan accordingly.
Okay, thank you very much, sir. Take care.
Hearst, Connecticut Media.
Hi, Governor. Looking at the downward trends in cases, positivity, hospitalization, do you think the vaccine is pushing these numbers down now? And if so, do you expect these numbers to continue downwards, or do we still not know yet?
I hope so, Pete. I mean, first of all, with everybody vaccinated in the nursing homes, you saw what nursing homes meant in terms of fatalities and hospitals and complications. That you saw in our chart last week, how that's bringing that number, that cohort down dramatically. I'd like to think that over the next month or so, as we get more and more the 65 and over, they still disproportionately represent, 80+% of the complications. So imagine what a difference that could make. As I've said, many times, we still have to watch out for these variants. They could spread very quickly, and we're following that. But so far, so good in Connecticut.
Thanks. And then I just want to make sure I understood what you said earlier. Is it that we'll know more about 65 and older in the next 10 days, a week or so, or is that when we expect to start actually giving people the shots?
I'd like to think that we're going to be able to give you a green light on 65 and over in a week or 10 days, and very soon thereafter, people will start getting their first shots. Maybe it'll take another week to get that done, but right now we're on track.
Thanks. And then this is sort of a data question. The CDC tends to estimate that the number of people who actually had the disease is about 4 times higher than the numbers that maybe show up in testing. Is that roughly accurate, do we know, for Connecticut, or and do we have a more accurate figure? And if so, do you think that's any part of this downward trend is just from the sheer number of people who have gotten the disease at this point?
I would think so. Deirdre, any thoughts on that, or Josh?
Yeah, so it's been a little bit since we did a seroprevalence survey in Connecticut, but there's no reason to think that the proportion in our state is drastically different from elsewhere. I don't think, though, that the downward trend that we're seeing now is likely related to a really high percentage of people being immune because of natural infection. We just haven't seen a large enough number of infections for that to be the case. So it's probably a combination of some people having immunity, vaccines starting to kick in, the mitigation strategies being effective, and the natural course of these kinds of viral epidemics. A combination of those 3 factors probably leading to these trends.
Thank you.
The Connecticut Mirror.
Has the state completed vaccinating people 75 or older who are under the state's control, namely people at the Department of Corrections and Connecticut Valley Hospital?
Yes. The inmates, the offenders 75 and older within our correctional system were vaccinated earlier this week.
And how about CVH?
Yes.
Okay. And Dr. Gifford, when issues come up like issues in Bridgeport with the local health directors, can you give us a better idea of precisely what is the role of the local health directors? This is a system that obviously has been evolving. There are elements of it that are more centralized than we normally see, in Connecticut with example tracking and tracing. So what is the role of the locals when it comes to rolling these programs out?
Well, I would say that it varies from department to department. And not every department has wanted, for example, to be a vaccination partner. Many of them have, the majority, but not every single one. Some have been more involved in enforcement of the orders and the sector rules than others. Some, as you point out, were more involved in contact tracing, and some left that more to the state. So our process at DPH has been to work with the local health departments. We are in daily contact with them. We have a regular twice weekly call with our staff and them where we share all kinds of information back and forth. I meet with the leaders every single week of the Association of Local Health Directors. And so it's kind of tailored from town to town. In the case of Bridgeport, as I said, they need some assistance now because of staffing issues. And so we're doing whatever we can to provide that assistance.
What are the reasons why some local districts are not participating as vaccinators?
Some of that's historical. They haven't, for whatever reason, developed the capacity. Maybe they have providers in the region that are able to fill that role. And some of them, when it came to this particular capacity, were busy with other things. They didn't have the staffing this time around. So it really depends on the district and what their historical capacity and current capacity to do all of the other important things they do, like restaurant inspection and sector rule enforcement and all of those other capacities that they have to keep fulfilling.
When you do get the guidance from CDC on which comorbidities are going to get priority, how will people prove that? Now, you mentioned in the case of patients of a large healthcare system, that will be done internally, I imagine. But the governor has expressed concerns earlier that one of the benefits of the doing it by age, that's a clear standard. So what are we talking about here? People going to get notes from their doctors, and are we going to be seeing those kind of games about who has a nice doctor who will write a note for them?
So one of the things that we're doing as we finalize this program is looking at other states and seeing how it's worked there. Some states are not requiring any type of verification and are relying solely on self-attestation. That has the benefit of simplicity, but it also obviously has some challenges in terms of verification. I think what the governor alluded to earlier in terms of working with providers to use the data that they have available to them will probably be one of our primary strategies, and then supplementing that with for the small minority of people that have those conditions that aren't able to get to work with their healthcare provider, we'll find another avenue for them to get the vaccine if they have the relevant underlying.
Last question, Governor. What's your inclination as far as simplicity versus having people prove they have a comorbidity?
Well, Paz, I can tell you, I've heard from dozens of doctors who have said, thank you for not making us determine who has a comorbidity and who doesn't. They felt under a great deal of pressure. Look, I think it's going to be a little bifurcated. I think the big mass distribution centers and the retail outlets and the such, that's easier to do, easier for folks to do online, easier to do based upon age, easy to verify, get a lot of people vaccinated quickly, especially those 65 and above. And then at the same time, we got to use our mobile clinics. We've got to go to those most vulnerable populations because they're often the ones that are least likely to either want to get vaccinated or feel comfortable knowing how to get it done. So I think it's going to be a two-pronged attack.
Thank you.
CT News Junkie. The Day of New London. The Hartford Courant.
Hi there. So, Governor, you've mentioned a couple times taking into account the variants as you figure out what to do moving forward. But at the same time, you've sort of talked about sort of beginning to loosen some restrictions in terms of restaurants, places of worship. So what role are the variants playing? How afraid are you that if we were to roll back, that the variants would necessitate us to shut down once again?
Well, we wouldn't have, pushed it till 11 o'clock and made the difference for houses of worship if we didn't feel pretty confident that we've got the vaccines and they're going to stay ahead of the variants. But that said, we look at San Diego, look at Miami, look at some of those places where the so-called variants, very highly infectious, are flaring up, seeing how fast that can move. Right now, I think we're in a pretty good position, and I think if we accelerate the supply of vaccines, we'll be able to stay ahead of that risk.
So when you say we're ahead of the vaccines are ahead of the variant currently, what exactly is that based on? What gives you that confidence?
Talking to folks like Scott Gottlieb, who say the variant is maybe accelerating in some places at 2 or 3 times per week in terms of constancy. If we're at a very low rate at like 0.1, 0.2% here maximum in the state of Connecticut, I think we have time as more and more people, especially the most vulnerable people, get vaccinated. That's what gives me some tentative confidence.
Got it. And I also wanted to clarify something you said earlier. It sounded like you made a comment that the state is working to narrow the list of underlying conditions that the CDC submitted. Do you plan to use the CDC list, or are you going to adapt the CDC list in some way?
I usually like to work with the CDC whenever possible.
So you're going to use the CDC list on the comorbid conditions?
Yeah, what do you think, Deirdre?
Yes, the CDC has a couple of lists, and I think the work before us is to clarify which of the conditions on those lists are going to be part of the early phases of 1B. That's what we've been talking about in terms of getting the more detailed information out about the rollout. So more to come on that. But we've been, the allocation committee and the governor have accepted the recommendations to work off the CDC list.
Got it. And one last quick question. I think 2 weeks ago, I asked about the declining number of cases and deaths in nursing homes and whether we were confident that that could be attributed to the vaccine. Josh had said at that point he wasn't quite ready to give the vaccine all the credit. Since then, it has kind of continued to decline. I'm just wondering, Josh, if your position has changed, if you think that the vaccine deserves the credit there.
Well, I think clearly we're far enough into the nursing home vaccination program where I think clearly there's significant benefit coming through. I do think we started to see it trend down before that point, though. So I think there's shared causality between, both the hard work of our nursing homes, the staffs there, the team at DPH, all the work around infection control. But as we're now, well beyond 2 weeks after many of them have gotten certainly their first dose, and many of them their second dose as well. Clearly there's contributions and protection coming in from the vaccines at this point.
Got it. Thank you.
CT News Junkie.
Thanks, Max. My question is for the Commissioner of Public Health. I just wanted to know, as far as guidelines for rationing care in state hospitals, why has the State Department of Public Health not come up with those yet?
Now, the State Department of Public Health doesn't typically promulgate those guidelines. We have put out sort of a framework in the past, but the hospitals are the ones that develop those crisis standards of care.
So the Department of Public Health isn't going to be putting out any more further guidelines then to the hospitals to use to make those decisions?
What we have said, and we've been planning for a while now, that we would revisit sort of the larger strategic framework that we put out about a decade ago. And it was on the books to revisit that process this year, actually. And so that's what we'll be doing.
Okay, so that's going to be done then later this year. I mean, I know that advocates have been asking for it to happen since March. I know that they're pushing for that.
We've been working with them, and we've been looking at what the hospitals have put out and providing some technical assistance to the hospitals around that. But they're the ones that actually promulgate the guidelines.
Thank you.
The Waterbury Republican American.
I think that could be it. Hey, let me just say, I'm really looking forward to Super Bowl Sunday, as I told you. It's one of my favorite events. That said, Deirdre wanted me to give you the classic caveat. If you can, stick to your household as best you can. No more than 10 people in that group. If you have folks outside of your family or a bigger group, please wear the mask. 11 o'clock curfew. All right, Deirdre, we got that message out there. I've also really cheered when we got that call from Bob Kraft, the owner of the Patriots, back at the end of last week, saying what we're going to do to celebrate the amazing healthcare frontline folks who have been taking the lead for us as a state and as a country over the last, now it's about 1 year. And we chose, the 4 frontline responders able to do that. And one reason they're able to do that, one reason they're able to fly down in the Patriots jet, one reason they're able to go to the football game and the Miley Cyrus concert is because they've been vaccinated. And they've been vaccinated twice and had that pause. So hopefully it gives you a little bit of confidence what a difference this vaccine can make. With that, here's some encouragement to take the vaccine.
By now, you've heard the good news. Connecticut is vaccinating our residents to help prevent the spread of COVID-19.
The vaccines have been thoroughly tested. They're safe and they're saving lives.
We're now vaccinating our highest risk residents, but that's just the start.
Vacunarse le protege a usted, a sus seres queridos y a nuestra comunidad.
Getting vaccinated is how we get back to normal.
Keep checking this website to see when, where, and how you can get vaccinated.
Come on, Max.
Play ball. Enjoy. Be safe.